Now we're going to take just a few moments and have a conversation with our learners. And I'd like for you to tell us a little bit about some of the concerns you had before you started your program. Like, were you concerned about a particular subject, or had it been a while since you had been in a learning environment? Was there concerns around structure of the program, travel, childcare? So I'm going to start with you. Is that okay, John?
Well, mine was about reading, spelling. I want to learn more about spellings. I want to know about more about spellings and reading and how to figure it out and how to do well in what I'm doing and to achieve what I'm doing and to make it better for me and others. I like to be able to make it so.
I had to resign myself for just so much, right, to how much time we had. But my first concern was finding safe and affordable housing. Someone that understood the fact that I had been diagnosed with PTSD, which is post-traumatic stress syndrome, and that it was from childhood trauma, and that I also had a PTSD dog, that most people didn't understand what they were when I got them. Now, when I would call and I'd say, "Do you take animals?" they would say, "Why? Are you blind or something?" You know, when I told them it was a medical dog, and most people didn't understand. I went to the Women in Transitional Housing, which is put on through the Y. They were wonderful. They let me stay there an extra year while I went to school, but it took me a long time to find that out. My other concern was funding for when I went to school. It took me 2 years to get the funding for school. Now, it didn't take me that long to get to, when I first started to go to Friendship Center, I knew that I was going to need maths and sciences. I'd already decided what I wanted to do, but I wanted to make sure that I didn't put too much on myself because I'm also a recovering person, and I know that to put too much on my shoulders would cause me to probably relapse and then not be in school again. So I left school at 14. I was afraid. I didn't have to relearn study skills because I never knew them. I never knew studies. I never stuck around long enough to know them. I had left school, and then I fought with addictions for many, many years, and it was like, do I have any brain cells left? Can I still learn? Those type of things. There was a lot of stuff, you know, so there was a lot. For me, it was just easier to take one thing at a time. I got my housing, and then I went to the Friendship Center, and I talked to, again, Chuck Scott wasn't teaching at me at that time, to do my maths and sciences because I knew those were the two things I might have issues with. I was more afraid of those. The other things I really didn't care. If I got them, I got them. But I knew I needed maths and sciences for what I wanted to do more. But I also knew I did have to take 4 subjects. So I did take the other 2, and I did okay with them. So I got that done. And like he said, like Scott said, at the Friendship Center, there's a lot of stuff there. So I could have a drug counselor right here on site for my hard days. The people looked like me there. There was a thing that made me feel comfortable. The surroundings was comfortable, it was gentle, it was all of those things. So, yeah. But my first concern was affordable housing, and second was finding someone that understood about my PTSD, or that would take the time to understand it. And just exactly like when I say to my teacher, I need to leave, then they have to, for them to understand I need to leave. I need to go out and walk around and come back, no disrespect to you, but right now you're going to be wasting both of our times if you don't listen to me, because now you're starting to sound like Charlie Brown's teacher, womp, womp, womp. And I have to get out of here. I have to go. So, and they were able to do that. They were able to hear that, and that's, that was a great thing. Oh, I guess we're going back to it right here.
So the same basic question, I guess, to the people who support the learners is what kind of challenges do the majority of your learners come in with, and how do you help them through those or negotiate those systems?
Well, just as Debra was saying, is that it's a lot of there's just so many issues that people have come in with, and trying to get them well, it's the affordable housing, the transportation, the child care, and they're not even coming back to learn yet. And then dealing with concurrent disorders, the mental health and addictions issues, because so many things can trigger them to do that, basically to go back to using again, especially stress. And all these things, all these new things are very difficult to deal with for someone in a new situation. However, and basically the biggest one is staying sober or abstinent from drugs, alcohol, or gambling. Is trying to help them do that has been what I see the most of because of where I work. However, with some of my learning is the most important thing, two things for people to stay sober or abstinent are meaningful relationships, which is their teachers, other support people, family, and then also meaningful employment. When I say employment too, I'm not saying it's basically if they're volunteering or if they're going back to school, that is their job at that point in time. And with those two things that they say that they're sometimes the two most important things to help someone stay in recovery and then follow their dreams.
So some of the common challenges at the Friendship Center, first I'll just mention, like Debbie said, people there looked like her, and it was inviting and sort of a nice cocoon of a place to be. Should make it clear that the Friendship Center is there to serve the interests of and the needs of urban Aboriginal population. But it is also by charter an intercultural center, which means the doors are open to everyone. And we do, like in our classes, we have people from the Sudan who are new Canadians. We have, the occasional white person. A lot of people, we don't get a stream of black people coming into the Friendship Center because there are services that are designed for that community just down the street. But we do get a mix of people. And, but with the challenges, and I said that because I don't want to mean that these challenges are specific to the Aboriginal population. They are specific to our adult learners that sort of cross a lot of lines. But they're that toxic cocktail of generational poverty, generational underemployment, often addictions, often a history of or current involvement with the justice system. Often a sense of, if not hopelessness, a kind of a directionlessness. There's been a lack of guidance or a lack of advocacy or mentoring or whatever it might have taken for people to develop a strong sense of themselves and where they want to go. And so, before you get to the ABCs, there's a lot of other stuff that needs to be kind of packed into place or unpacked and kind of looked at. And we're fortunate at the Friendship Center, I know this is getting into the next question, but you did it. Because we get a multi-service organization, so we do have a drug counselor in-house. We do have training and a really extensive training and employability services in-house. And we've got elders that are available to people. So there's a kind of a wide range of stuff that's available without having to even leave the building.
Thank you very much for that.
Okay, I think I should probably preface this by saying that I did start working at Halifax North Library in 2004, which is when I first met John. And I think that there are so many challenges that a lot of the learners come in with that sometimes it might take them 2 or 3 or 4 or 5 separate times before they can truly commit to the program. And so when I first met John, he'd been in the program with a coordinator before me, and I set him up with a tutor, and she was great, and they got along well, but John didn't have a phone at that time, and so he disappeared for 3 weeks, and I didn't have any way to contact him, and I didn't know where he was, and then he came back, and by the time he came back, I couldn't set him up with that tutor anymore, so I just put him back on the wait list, and off and on, I wasn't able to match him up, because when I'm working with volunteer tutors, they're giving their own time, and if their learners don't show up, they just leave the program entirely, and then we have a problem because then we don't have enough volunteer tutors in our program. This past year, John's attendance has been 100%. He has not missed one session in the entire year. He's our true success story. And I think that you know, I have a lot of learners, I've had learners come in and within 5 minutes of meeting me are crying in my office. They've had really hard lives, far harder than I've had. And you know, I've come from a relatively privileged position. Dealing with drug addictions, dealing with mental illness, dealing with learning disabilities, falling through the cracks of the school system. So one of the largest things is just having them show up is amazing. Having them show up consistently is incredible. But yeah, and I think probably the biggest challenge that I face is once they're working with a tutor is low self-esteem. So it can be really hard for them to believe that they can learn things and that they're intelligent and worthy. And that's where one-on-one tutoring is really great, is they can really develop an excellent rapport with the tutor, and it's really very personal. But yeah, so certainly that sometimes I think as a tutor and as a coordinator, you need to not be judgmental. And if it takes somebody 5 separate times to actually commit to the program, then that's fine. That's how long it's